Hi, it's Jessica DeMassa with WTF Health. What's the future of health? We're bringing you this special series on how different health tech startups are responding to COVID-19. And now joining me, I have somebody who's going to help with some advice for those health tech startups. So with me right now, I have Dr. Ashish Atreja. He is the Chief Innovation Officer of Medicine at Mount Sinai. He's also the founder of Node.Health, which is a clinical validation network for digital solutions. And he's the founder of Rx.Health, a triple threat, which Rx.Health bundles different digital tools together to make it easier for hospitals to deploy. And the reason that we reached out to Dr. Atreja in the first place was to talk to him about Rx.Health and this new digital tool bundle that they've put together for COVID-19, for the COVID-19 outbreak. So Dr. Atreja, a pleasure to have you with us.
My pleasure, Jessica. Thanks for having me.
Tell me a little bit about this with Rx.Health. You guys have kind of sourced together and curated some of these solutions that hospitals can quickly put together and deploy in the face of COVID-19. And this is really important because I think, you know, as certain clinicians or certain practices or certain hospitals are in different places with rolling out digital tools, and there's so much out there. How do you know what's best in class? How do you know what you can deploy right away? So give us a little bit of a background on this. How did this come about?
Yeah, so I think we started this effort only 2 weeks ago, and we call it Covered.Health. Basically, how do you protect yourself from COVID, and how do you bring everyone together? And it's an ecosystem of multiple digital health partners, which have come on a common platform, Rx.Health platform, to really unify delivery around COVID fighting. And this has been our journey that started 7 years ago. From Cleveland Clinic, I came to Sinai, took the role of the Chief Innovation Officer in medicine. And we built apps. We were second in the country to have a full in-house development app with data scientists, developers, all within a health system, like a startup within a health system, 2 years after iPad came. And the goal was, how do we enable digital health to really scale into patient-centered care and value-based healthcare, right? And one of the things we have learned is it's easier to make an app now. It's like a web page, which used to be before, right?
Right.
But the value is not in creation of innovation. The value is delivery of that innovation and transformation. What if that innovation is just logged and doesn't touch patients' lives? It's meaningless. And that's what's happening to most of the apps, most of the technology these days today, because it's so fragmented. And we call about augmented reality. Augmented reality is alternate reality within health system. But we're looking at all those solutions. Many of them are really good, but we can't stitch it together. And for every single solution, there's a separate workflow, there's a separate data flow, there's a separate training, there's a separate contract process. And we cannot bring the things together in digestible fashion. I'm a gastroenterologist, so I talk about digestion all the time. So we need to make digital health digestible within health systems, within health plan.
Right.
So when we were looking at COVID, we knew there were chatbots out there. But we also know we need more than chatbot. We need someone to be triaging that, and we need to turn virtual here with telehealth very fast. And we need something to prevent, not just on the website like a chatbot. We need to have a screener within appointments so patients don't come who are exposed to the facility and expose others. And then if you do that and you have a telehealth, you need a way to monitor the population, because sickest of the sickest are actually going home. We're only reserving COVID patients typically for the hospital, but we never managed that sick patients at home before.
Yeah.
So we need to, at the same time, enable digital health monitoring. So which means there's not a single tool that can do all of that in an integrated fashion. So we have to bring the ecosystem together to deliver a full breadth experience around COVID fighting.
Okay, so how is that unfolding? How are you using that currently right now? Give us some of from your experience, like with working this within either Mount Sinai or with some of your other clients. I mean, tell me how it's going.
No, it's great. I think our division chair in gastroenterology had a vision 2 weeks ago that, hey, we are getting a lot of immunosuppressed patients who may stop their immunosuppressive agent period of COVID. So we need to not sit on the backside, but really do outreach to them right where they are using a digital navigation program. So instead of just having a finger on just having a website and patients coming to that, we actually reached out to 6,000 patients. And 40% of them actually wanted to be monitored on a regular basis. And we found 135 patients who actually had some symptoms and triaged them immediately into telehealth call or others. So we launched that within a day. And we found such a terrific engagement. So then we extended this model through Rx.Health to outside other health systems. So Yale, we are now supporting around 1,000 telehealth visits at Yale.
Okay.
So which were 4 a day to 1,000 a day. So that's the thing. And we support the complete workflow around the telehealth. The main challenge with telehealth is not just getting a video visit high quality, making the patient show up. There's a very high no-show rate. Making sure they're able to download the app if the app is downloaded. Making sure they do the sign-up process, they agree to the terms, they follow up. That all takes 90% of the effort. So we were able to automate that using a platform approach.
Okay.
So we have telehealth going on there. We have digital health monitoring going on. Then we turn on a bot called Covered Bot, basically which can actually triage the patients right to the triage nurses as well. And now we are enabling what we call as digital health monitoring mainstream, which means extending beyond IBD. Can we take care of transplant patients, ACO population, right? Really nearly entire patients that are at risk. Can we monitor them immediately if patient triages from an ED to a hospital? How can we monitor them very safely at home during the 2 weeks period or more?
Yeah, and I mean, I think that question of how do you continue to monitor people either with or without COVID at home is going to be a question that's going to be asked with increasing frequency as this continues to move forward. I wanted to ask you, speaking from a clinician standpoint and working within a hospital system and working with other hospital systems, you had mentioned Yale. I mean, so when people are looking, and for our digital health audience that is watching, when the clinicians are together, when the hospital administrators are together and they're talking about chatbots, they're talking about remote patient monitoring in the home, they're talking about telehealth visits, either, going B2B or going direct to consumer. What are some of the common questions or some of the common hesitations that those folks have in the room that we may not be privy to? And if you could talk about that, I mean, even in the context of, whether it's in the context of COVID-19 response or not, what are some of the most common, I guess, fears or the common questions about risks that are going to be taken?
Right. So I think we have seen a sea change in the last 2 weeks versus what was there before. The couple of things which are still in common. A lot of the CIOs now initially never thought of a platform approach because they said, oh, there's one tool for diabetes, let's bring it on. And it took 1 or 2 years after they brought it on to say, hey, we need to bring something for hypertension, something for this. I can't manage that in my team, these 50 different companies. So now the conversation for the last 1 year has been about platform. So even if we are going as a covered, a lot of the discussion we are having is, hey, what's beyond 3 months? They want to invest in a platform which actually gives them scalability and sustainability beyond COVID. So they are having that kind of a lens on, which I think speaks to the maturity in the place and maturity in the understanding that they really are thinking in a much more holistic manner, not just a one stopgap solution.
Okay, so even now in this time of crisis, they're thinking about what's coming next as well.
That's correct, because everything can be fast-tracked from legal to security to others, but that opportunity may or may not sustain afterwards.
Right.
So
what's your feeling on that?
Right?
What's your feeling on that? Do you think that some of these changes that have been put in place so that things can get fast-tracked, are we going to go back to the way it was exactly? Or do you think some of this stuff is going to stick? Because, I mean, now that we've seen how quick a hospital system can move in some cases, I don't know if we're going to believe it if they need 9 months to do a contract again.
Yeah, we are doing one site a day. Yesterday, we did a whole emergency department in Texas, complete pathway. Any patient that comes, COVID or non-COVID, because they don't admit too many patients now, they are able to do a digital program for them which monitors them and gives a ping if they are not doing good, whether it's COVID or non-COVID across the enterprise, right? So we are seeing, I think there's going to be new level setting. I do feel how fast it is going right now may not happen after 3 months once the COVID crisis has gone away. The funding may also dry up and the urgency may dry up. But I think there'll be some things people may have tasted it enough. For example, they've tasted enough virtual care and see how compatible it is with good clinical care. And that gives a level of comfort on clinicians, administrators. A part of it is gonna stay forever. I think some of the fast track process they do from contracting process, they will realize, oh my God, there's much more value in getting things done than dealing in 9 months because there's so much value. I was just talking to a federally qualified health center. They have no tools right now for telehealth, and they have gone to completely phone calls. And they are thinking they may not survive for next month because the billing is completely zero right now while the technology is there. I was talking to a gastroenterology practice. They laid out 40 people yesterday.
Wow.
Right? Because screening colonoscopies may not happen till 3-6 months. right? So there's a real risk of many practices going down under, and digital health can immediately salvage them. Get them at least some remote visits, get them some continuity, get the staff level maintained till they kind of ramp up later on. So seeing that relationship, unlike EHRs, which was forced many times, this is adopted as a need. I think, and once you taste it, you realize that it's not as different. We call it demystifying digital health. Digital health is basically health. Digital medicine is medicine.
Yeah.
And the same best practices you do in clinical medicine, the same ethics you have, the same thing, everything stays the same. It's just the mode of communication changes, from a person sitting in front of you to communicating like I'm communicating with you right now.
Right. I want to ask you a question on this point of demystifying digital health, because I do like that. So, I mean, in this time where folks are trying to make decisions quickly, and maybe bring in digital solutions or telehealth solutions that they hadn't brought in before, what's your best advice for a hospital system or a physician practice that's looking at a digital tool? What's your best advice on the questions they should be asking of that company, knowing that you're not going to maybe have time to go through a 10-month long diligence process here?
Right.
So what are the key things that they should be asking?
Right. I think the key thing they should be asking is evidence. Have you worked this and have you done this, and show me how it has improved outcomes.
Okay. And as far as that goes, how much evidence? And that's always been a question in digital health is is the one study enough? Is a 2-hospital pilot enough? Or do we need is the expectation the same thing as what would go along with a clinical trial for a major pharmaceutical drug?
Right. Absolutely. And I think it doesn't have to be as rigorous as digital therapeutics or FDA approved treatment. I think there's some kind of a variability there, and it's okay not to go to that level. I think where I am able to distinguish a good vendor from not a good vendor is implementation science. Because technology sometimes is tough to judge. They kind of look and feel the same way. There's one graphics and other graphics. But what is the DNA of the team that implements it, right? Do they really care about how it is done? Not what it is, but how it integrates with the workflow. Do they care about holistic value rather than their product just getting, adopted? And because those are the partners you want in the long run, who really want to make a meaningful difference than just the product coming out. So that implementation science part, that they will know all the workflow, but they've already thought about it before you ask it. Right? Or they're saying, that's a great feedback, let us get back to you. So that's one thing. Another part is the support structure. Are they still responsive?
Okay.
I think you still gauge a lot. But really where I think is this is such a great opportunity in such a crisis time to actually look at not your immediate need, but what your entire health system needs are. And is this thing gonna fit into a wholesome solution? Because the solution you're gonna bet on can be a catalyst for your entire digital health strategy and platform. And you may never be able to test it that fast if you don't bet on the right horse.
Right.
So there's no pressure to bet on the right horse, but I think this is a moment of opportunity where you can see what is going to give you long-term benefit and not just one point-and-click solution. Don't look at telemedicine as just, hey, I'm just going to get one video visit, a Skype or something and get away with it. Is it right with your workflow? Is it ultimately going to be okay with your privacy laws when they're going to be coming back to it? Are you supporting your below? Is it, are the patients coming back to you in Skype and you can't block them, right? And medicine is just one part, video visit. How are you doing remote patient monitoring? How are you doing? So I think looking at it in a holistic, integrated manner, no matter how small or how big you are, I think is I would say, a lens that everyone should have.
Okay. All right. Last thing for you, I want you to flip it and give some advice to those digital health, remote monitoring, telehealth companies who are trying to, get the attention of these folks in hospital systems or get attention of clinicians so that their solution can be integrated in. I got some good advice previously from Bruce Greenstein, who had just said, I don't want a marketing brochure. I need to know coverage areas. I need to know pricing. I don't have time for that. So what's your best advice for digital health startup?
The number one thing people are looking for make decision is how fast you can implement.
Okay.
That is the number one priority for people. Is it good? If it's good, how fast you can get into us, how fast you can make it real. So the faster you can spread your implementation cycle, make it very fast. I think that's what people are looking for right now. That's my number one advice. I would still advise don't sacrifice quality. because you may get in one day, the moment there's a bad quality, that creates a relationship when it's completely, breaks all the future engagements in that regard, which is a tougher thing to do when you're scaling up and show and still provide the quality. But I would say no one has to scale infinitesimally, but scale with quality as much as you can, so the trust gets built. And these becomes, convert those engagements into long-term engagements if you can.
Good. Dr. Atreja, it's such a pleasure to talk to you. Please stay safe. We'll have to pop back in with you and get an update as things unfold and continue to change here, especially on this integration between digital health and virtual care into the healthcare system. I really appreciate your perspective. Thank you for sharing.
Sure. Thank you so much, Jessica.
Thank you. So for the rest of you who want to check out some of these other interviews that I have done with some health tech leaders in and out of hospitals, in and out of politics, in and out of startups, please check out my YouTube channel. That is youtube.com/WTF Health. All of our interviews are posted up there. And again, Dr. Atreja, a pleasure to have you.
Same here, Jessica. Thank you very much.
Thanks for talking to us. Bye-bye.